Welcome back for the second portion of Joy in Our Town. Thank you for joining us once again. I'm your host, Tammy Jo Johnson. Our guest for this segment is Tonia Still, child welfare caseworker in Kinship Care for Franklin County Children's Services. She joins us today to share important information regarding kinship care, along with how Franklin County Children's Services rely on kinship caregivers. Thank you so much for being here with us today, Tonia.
Thank you for having me.
So before we get started about kinship care, tell us a little bit about yourself and about your history with Franklin County Children's Services.
I've done a multitude of things at Children's Services. Started off as a regional ongoing caseworker and moved into intake and investigations. I've done the foster adoption prep, home studies, licensing for prospective adoptive parents, and now I'm currently serving as a kinship caseworker.
Wow, so you've been there for a while.
15 plus years working with children and families.
Passionate about it. That's good, because there's a lot of people that don't think people in that position care, but you care because you've been there forever.
Absolutely.
So tell us what kinship care is first.
Kinship care is, unfortunately, we have some of our most vulnerable children who are not able to be with their families, and so when we do require out-of-home placement for a variety or for a multitude of reasons, it could be incarceration of parents, death of parents, abuse, neglect, issues of dependency such as mental health of parents, and children can't remain safely in their birth homes with their birth families, then we look for alternate caregivers. With the most ideal being somebody who is blood related to them or has a biological connection to the child, or somebody who has a close familial connection with a child. So it could be a fake aunt, it could be a family friend, it could be a teacher, anybody who has a commitment to that child and is willing to maintain those family ties and cultural connections.
So it's almost like foster care, except they're kind of related, or they're familiar with the family?
More familiarity, so that's definitely the more preferred route to go for children. It's somebody that they're already familiar with, somebody that they already have an ongoing relationship with, so somebody who has definitely more of a commitment to that child and their well-being.
I see. So because this is a family matter situation, does it have to be approved by the court system?
Not always. We get children in kinship care through a variety of ways. It can be something very informal, an agreement within family members or from the parent to the prospective caregiver, to something very formal where it's a formal legal out-of-home placement. But even in that type of a situation, either the caregiver can have custody of the child, or we as an agency can maintain custody and place with kinship caregivers.
Wow. So is a lot of the kinship care, are they grandparents?
Not necessarily.
No?
Like I said, a lot of them are, but we have aunts, uncles. I've worked with families where adult siblings of the children themselves are the caregivers. Again, friends, coaches, teachers. It can be almost anybody, again, that has a connection, a cultural connection with that child.
How do you keep in touch with them? I'm sure you do, but what is it like to keep in touch with them, to monitor how things are going? If the child is, happy, or if they're, how do you do that?
We maintain ongoing contact with our families. We meet with them face-to-face at least monthly, but there are telephone conversations, there are linkages with community support resources. We're working with the ongoing regional service teams or the intake service teams. So as an agency, we're having a lot of face-to-face contact with that child and a lot of face-to-face contact with those families. So it's an ongoing assessment. It starts at the kinship level with the home study, where we go in and we assess potential caregivers, doing the physical safety audits of their homes. We're looking at criminal background. We're looking if they've ever had any involvement with children's services themselves as adults or children. So we're doing all the necessary background checks, because at the top of our priority list is children's safety.
Right. And that screening process, it doesn't seem, is it really invasive? Like when you go to the home, are you looking for specific things, or are you just looking for, that home being a safe and good place?
We want to make sure that the home is safe, and so we not only assess the immediate caregiver, but we're also assessing all adult household members, as well as other children. It can be pretty invasive, unfortunately. We want to make sure that the family has the well-being to care for the child. We want to make sure that resources are there to care for the child and to meet the children's needs. Our children come to us with a lot of trauma, And so we want to make sure in that assessment piece that they're able to identify those trauma triggers and make sure that they're really able to meet the needs of the child on a social, physical, emotional, medical level.
That makes sense. So do they get, I think you said it, supportive services? Do they get support from different services in the community to help them care for that child financially and stuff like that?
Absolutely. That's one of our roles in kinship, is to make sure we are working with those caregivers to link them with community support services. It costs money to raise kids, so we want to make sure that we're linking them with job and family services for child benefits such as cash assistance, food assistance, medical assistance when applicable. One of the challenges that we have is, though, when they're not related to the child by blood, unfortunately, unless they have custody, they're not eligible for those benefits, those child benefits, the cash assistance or the medical assistance. So that's one of the challenges and the hurdles that we're constantly coming up against. But as an agency, we kind of fill in those gaps, or we access other community resources to kind of fill in those gaps. In terms of support services, we partner a lot with community agencies. We have the settlement houses, the neighborhood houses, the Central Community House, Gladden House, that serve as hubs where families can go to access community resources right in their zip code. Fostering Connections through Children's Hospitals is kind of a one-stop medical dental shop. So we partner with a lot of community agencies, and we're making sure that we're getting those resources out to our caregivers on an ongoing basis.
Nice. So, okay, so going back just a little bit, I know you've been doing it for a long time. Is there ever times where you have to say, no, we can't place a child, and if so, why?
We do. Unfortunately, one of our top priorities is to make sure that if we're removing children out of a situation, that we're not putting them back into a situation that's going to put them back at risk or re-victimize them.
Right.
And so we do. It can be anything from criminal background. It could be previous history with the agency. It could be, we try not to do it on resources. We want to make sure we're plugging in. But sometimes physically, it could be the physical health of a caregiver. So for lots of different reasons, sometimes we just aren't able to make that placement happen.
So what about the good stuff? Do you have any success stories that you can tell us about, or one?
We do. Again, we depend on these caregivers, and these are people that have a natural connection with the child. So even if they can't serve as a placement resource, they can still pour into this child's life, keeping them connected to their culture, to their school, to their community, in a different ways, not necessarily as a caregiver. Success stories, we see them every day. Sometimes, unfortunately, kids can't be reunified with their parents. They can't go home. And so when those sorts of things happen, then we want to make sure that every child has a permanent living situation. Permanency is huge for children. And so we have kinship caregivers that are taking legal custody to make sure that, that this child can have a permanent home or somewhere that they can be until they turn 18. Right. And so then they're responsible to put into them all the tools that they're going to need to be successful as adults. We have so many caregivers, and we try to celebrate them whenever we have an opportunity to celebrate them. We have quarterly support group meetings. We have an annual kinship conference in September where we bring our caregivers together because we really do want to celebrate the work that they're doing with these children.
That's amazing.
There's the Ohio Grandparents Kinship Coalition, so there are other community agencies out there that recognize that this is no easy task.
I was going to say, so, positive, I'm sure, but what effect does that have on the people that are the caregivers, the people that are taking in these kids and they're not really there, and it was probably unexpected sometimes? What is it like for them? Do they report on that, or do you talk to them about that?
We do. When we're making those monthly home visits, not only for the kids, but we have to make sure that the needs of the caregiver are being met as well. And so we're consistently talking to them. It's a huge change in roles. If you're gone from a grandparent to now you're parenting, it not only changes the dynamic, the relationship you have with your grandchild, but now with your own biological child who's the parent of this child. So we help them to work through all of those sorts of issues.
So what advice can you give our viewers who are either looking to become that? Because you have to think about it. Is it a situation where they can just sign up, or does there have to be a case involved?
these things happen all the time. Kinship, I think, is a naturally occurring thing in our community, where we might take in a relative child, but on a more formal level, it would have to be a case opening with Children's Services for us to be involved to get that level of support. So yeah, they come to us through the cases that we have through our intake or our ongoing regional service teams.
If there's already an existing case, and let's just say a family member or viewer didn't know that they were able to do that, where would you send them? How would you go about?
Either the caseworkers can get them connected with the Kinship Department, or we do have a phone number for our Kinship Department, 614-341-6161, where they can call directly to get information about the Kinship program, and then also at kinship@fccs.us. They can also get information.
Wow. So tell us what the future looks like for you in this program. Do you see any major changes coming along? Or you said there were success stories, but do you ever have a situation where a child comes back and they say, you know, I just want to say thank you, because if it wasn't for being able to live with my grandparent or aunt, or do you ever get that?
We do see that. You know, we see some generational families, and so we do have some kids that come back, and sometimes we see them on the other side. We have kids who came back who have gone through the system, and now they're caseworkers. You know, now they're working for the agency, or they're working with the agency in a volunteer capacity. So we do get those thank yous, spoken and unspoken.
How does that make you feel?
By giving back. Great.
Great. Yeah. So,
very fulfilled.
I mean, because I didn't even know, I mean, I'm not familiar with Kinship Care until now, but where can we find more information on what that means? You said that you can go to a website, right?
If you Google Franklin County Children's Services and go onto our public website, it has a list of our programs, and included on that would be Kinship. And then it can also link you with some other resources in the community, like the Ohio Grandparents Coalition, Kinship Coalition, and some other resources.
I was going to ask you that. I meant to ask you that earlier. So the different agencies that you partner with in the community, what are some of those agencies?
St. Stephen's, Neighborhood House, Southside Settlement House, all of those. We partner with JFS, Job and Family Services, Fostering Connections. We have different community events that we do as well.
So it is like a web of services. It's not just,
definitely,
they're not just placed. There's like this whole big web of services.
Absolutely. We couldn't do this work alone. We definitely rely on the community and our community partners.
Wow. Thank you so much for being on the show with us today. I know that a lot of times social workers in places like that don't realize the impact that you have on children, and the fact that they're being placed someplace where they're safe and secure. And so, I mean, I personally just want to say thank you, because that's a big job, and you guys are doing great.
Thank you so much.
You're welcome. And thank you for being here with us today.
No problem. Thank you for having me.
That's our program. Thank you so much for watching. You can also check us out on Facebook at WSFJ-TV51. Join us again next week at the same time for Joy in Our Town.
This program has been sponsored by the Trinity Broadcasting Network and is made possible by your telethon dollars. Your continual support can keep Joy in Our Town coming to your home every week. Write to Joy in Our Town, 7790 North Central Drive, Lewis Center, Ohio, 43035.